Hello, and welcome to the 2025 Southern Region Burn Rehab Workshop. This year, we're offering hybrid course with previewing of video lectures and an all-day in-person practicum at the Southern Region Burn Conference in October. The workshop is scheduled for Thursday, October 30th in Charleston, South Carolina. I'd like to recognize the people who have helped with planning this year's workshop. From the SMA, Director Randy Glick and Operations Administrator Kendra Blackman, the Southern Region Burn Group Chair, Dr. Jimmy Holmes, and Program Chair, Dr. Bill Hickerson, and our workshop committee members, Heather Dodd, Jenna Kelly, Deb Knight, CJ Acosta Staples, Rachel Zaloni, and Lindsay Harris, and advisors Jonathan Nizak and Michael Sergio. We will also be joined by additional therapists from the MUSC Host Burn Center at the on-site workshop. This lesson features compression therapy in burns. I'm Donna Nakamura, Chair of the Southern Region Burn Rehab Committee. Thank you for joining us for this year's program. We're looking forward to a fun day of casting and compression and networking with other practitioners in burn rehab. My disclosures include that I am a speaker consultant with Avita Medical and a key opinion leader with PolyNovo. Objectives for the first part of this two-part series include examination of compression therapy practices with historical references and evidence-based practice guidelines. You will then be presented with practical knowledge and treatment interventions that can easily be put into practice. Compression therapy is an important component of the rehab process for management of burn scar, by interfering with the production of collagen and aiding in realigning collagen fibers. Benefits include protection of fragile skin, vascular support for circulation and for pain mitigation, reduction in pruritus and edema, aiding in soft tissue elongation, softening and flattening of scar, and pigmentation return. The use of compression dates back to the late 1600s with the work of Perret. Through several centuries, compression has gained efficacy for the management of scars. Use of compression or pressure garments is substantiated in the literature. Although there is limited evidence supporting the effectiveness of treatment, compression continues to be an accepted practice. Compression is a standard therapy for scars due to its non-invasive characteristics and desirable treatment effects with few complications. The general guidelines for pressure exerted is 20 to 30 millimeters of mercury, which is greater than capillary pressure and less than peripheral circulation. Custom measured and fit garments are most effective. However, they are associated with high costs and potential patient morbidity as listed here, with overheating, especially in warmer climates, pruritus, blistering from shearing forces on the radi pegs, wound breakdown, and abnormal bone growth. Ataya conducted a data analysis, and this was published in 2013 in hopes of establishing guidelines for the use of pressure garments. Their conclusions still exist to this day. Reliable measures of scar and pressure dosage for successful scar control remain challenging. Patient compliance is also an issue, and pressure therapy is but one component in the total rehab program for patient care. A systematic review by Harris stated these proposed outcomes for inclusion in scar improvement per parameters of thickness, vascularity, pigmentation, and pliability. They also looked at pain, pruritus, adverse events, complications, quality of life, and adherence to therapy. And they concluded the following: that pressure garment therapy is costly, challenges with wearing garments leads to compliance concerns, and that compression does work by remodeling collagen and realigning fibers. Many studies have addressed the patient and therapist perspective of compression therapy. Staley and Richard emphasize the critical importance of patient and family education about realistic and potential outcomes. In Crofton's review, non-adherence to compression therapy revealed 6 themes: sensory factors, psychological state, impact on function, availability of social support, degree of choice, and education provided to the patients by their therapists. The work of Coughlin examined the patient experience of wearing garments and identified the themes of what it feels like to wear garments, what it's like to be a patient on the burn service, impact of garments on lives and recovery. And in addition, the themes of what patients want in terms of education, peer support, and input into their garment decisions. Nedelec and colleagues from Canada conducted a prospective longitudinal case series with pressure applied by garments at baseline, 1, 2, and 3 months in recovery, as well as wearing time and location of scars. Their findings were that 2/3 of garments were not applying adequate therapeutic dosage of pressure. Conclusions included that 1, burn practitioners were underestimating their pressure dosages for treatment of scar, and 2, that garments lose pressure within 2 months. Here are some online resources for patient education, including the Phoenix Society, burnsurvivor.com, Health Partners, Metro North Hospital in Brisbane, Australia, and the Burn Model System Knowledge Translation Center. These are the references, and we will also be providing you with printed reference lists at the hands-on practicum. Thank you very much. If you have any questions, please feel free to contact me at this email. Now, it gives me great pleasure to welcome Amelia Heckman and Caitlin Clark from our host burn center at MUSC in Charleston, South Carolina. They will review practical information about burn compression, including interim and custom compression, proper fitting, wear schedule and care of garments, as well as insurance authorization and coding and billing information. Compression measuring techniques will be demonstrated at the hands-on practicum on October 30th, and we will have breakout stations to further discuss and demonstrate compression products and innovative ideas. Thank you for your time, and we'll see you in October.
Hi all, we're here today to give you our rehab pre-con lecture on burn compression.
We have no financial relationships or conflicts of interest relevant to this presentation. Content presented is based on current best practices, evidence-based research, and clinical experience. Any images, diagrams, or references are used solely for the educational purposes to support learning.
I'm Amelia Heckman. I am one of the OTs at the South Carolina Burn Center.
And I'm Caitlin Clark. I'm the other occupational therapist here at MUSC.
The objectives of today's lecture include understanding burn compression, when to initiate compression, Describe various types of compression, when to measure for compression and how to measure for compression, and the benefits and contraindications for compression.
The purpose of compression garments play a vital role in the healing process after burn injuries by improving scar outcomes, protecting skin, and enhancing comfort. Compression garments are a key component in burn rehabilitation. They help scars mature properly and reduce the risk of hypertrophic scarring by applying constant pressure. They also make scars less itchy, less painful, and reduce sensations like throbbing or tingling. Another important role is preventing fragile skin from blistering or reopening, while also offering protection to areas with poor integrity. Lastly, they help control swelling, which improves overall comfort and function during recovery.
Compression garment initiation can begin when a patient's wounds are 90 to 95% closed. This can occur in the inpatient or outpatient setting. If patients have small open areas, you can place your primary dressing over the open area and utilize a secondary non-adherent dressing if necessary to maintain dressings in place under the garment. Bulky secondary dressings should never be utilized under compression as it can cause skin breakdown and pressure injuries. The photo on the left depicts a hand that is not appropriate for compression. There are many scattered open areas that will still require both primary and secondary dressings, while the photo on the right depicts a hand and arm that is ready for compression. Only 1 to 2 small scattered areas remain that can be placed in a primary dressing and appropriate for compression to be donned over.
Intermediate compression garments are a quick and effective during the transitional phase of burn healing when wounds have closed but scars are still immature. Off-the-shelf garments are an excellent option for intermediate compression because they're readily available and don't require insurance authorization or a referral. When fitted correctly, they can provide adequate pressure, usually between 25 and 30 millimeters of mercury, which helps manage scars effectively during the transition phase. They're also easy to care for, making them a convenient solution for patients waiting for custom garments. They're also more affordable, making replacement easier, as well as offering a quality option for those who cannot afford customs or whose insurance payer does not cover.
We begin utilizing intermediate compression garments, which include tubular compression sleeves and compression gloves. Sleeves are fit based off of extremity size per the compression brand instructions. All compression should always be placed to allow for distal to proximal compression. If a patient has hand and upper extremity burns, they should be fitted for a glove and a compression sleeve. The glove and the sleeve should always be worn in conjunction to prevent distal edema. Additional types of compression include vests and shorts or leggings that are also able to be purchased from various vendors.
Accurate measurements ensure effective pressure and comfort for patients. When applying tubular compression garments, always work from distal to proximal to ensure proper gradient pressure. Measurements can be taken in either inches or centimeters, depending on preference. If more than one interim garment is needed on an extremity, overlap them by about 25% and maintain a good gradient from distal to proximal. It's also important to check joints like the elbow or knee to make sure the garments don't shift during movement and expose the skin. If you notice the garment on the top left, how there are wrinkles and extra material at the distal end, this would be considered an improper fit, compared to the garment worn on the top right, where it is a smooth garment without extra bulking or bunching. And the bottom image demonstrates an interim garment of a glove and forearm sleeve that are worn together for optimal compression.
Now we will move into custom compression. Custom compression will provide the most adequate and best compression for burn scars on the market. Not all burn scars require or benefit from custom compression. Who will most likely benefit from custom compression? Your patients with autografts and or hypertrophic scarring and or patients with a greater than 20% TBSA that have concerns for functional deficits. The biggest factor when considering custom compression is a payer source. Custom compression is expensive and many insurance policies do not cover it. Out-of-pocket costs can typically run anywhere from $300 to $2,000 per garment. Often, even if the patient has an insurance benefit that covers garments, a deductible, copay, or partial payment may be required by the patient, making custom compression challenging for many patients to obtain due to the financial barriers.
Custom compression garments are designed to meet individual patient needs and provide optimal scar management. Custom compression garments benefit patients who are at a higher risk for scar complications or functional deficits. This includes those with healed burn wounds, at risk for hypertrophic scarring, patients with autografts, extensive burns, or burns involving joints, where mobility and contouring are important. Garments are also critical for hands, feet, or facial burns that require precise fit and for managing persistent edema. They are ideal for patients transitioning from interim garment to long-term scar management, especially when burns cover more than 20% of total body surface area or wounds take longer than 21 days to close.
Like I spoke about earlier, the biggest factor when considering custom compression is a payer source. It is often expensive and not covered by insurance companies, making custom compression challenging for patients to obtain. If a patient has a payer source, you will then measure them for the necessary custom compression. On the back end, you may be required to complete paperwork for billing and insurance authorization. Ensuring the appropriate codes are documented will allow for insurance companies to run authorization on garments. One of the following codes that I will list must be documented as a patient's diagnosis prior to measurement. L91.0 for hypertrophic scarring, L90.5 for skin condition or fibrous of the skin, Z94.5 for skin transplant, or any L code starting with T and ending with A that represent each part of the body that will receive compression. For example, the left wrist would be T23.372A as the documented associated code for the compression. Other considerations for placing a patient in custom compression garments include a patient's ability to return to clinic for fitting and modifications of garments if required, as well as the patient's range of motion and strength to be able to don the garment. If a patient has poor range of motion and strength and no caregiver to assist, donning a garment will be challenging and unachievable.
Custom compression garments are designed to fit specific body regions and scar locations to provide optimal pressure, comfort, and mobility. Common types include sleeves and stockings for the arms and legs, gloves and finger splints for hand burns, vests and torso for the chest and back, hoods and masks for facial burns, and custom footwear or socks for feet and toe burns. Interim combination garments may also be used when multiple areas need coverage before the final custom garment is ready. Each garment is tailored to the patient to ensure effective scar management and functional support.
When measuring for custom compression, accurate measurements are essential to ensure the garment provides therapeutic compression without causing discomfort or restricting circulation. Preparation is key. Measure first thing in the morning or after swelling is reduced. Have the patient stand if possible or if necessary with good posture to make sure the garment will fit appropriately. Have your tools ready, including a flexible non-stretch tape measure or the provided measuring devices from the vendor, and record measurements in centimeters for precision. Measurements should be taken circumferentially. Snug, not tight measurements at key anatomical landmarks are important. When measuring length, measure along the limb from a bony landmark to the determined length of the garment. When documenting the measurements taken for custom compression, record immediately and double check for accuracy. Follow the manufacturer's measurement charts to ensure correct fit and correct measurements were taken.
Accurate measurement and correct wear maximize compression benefits, comfort, and scar management. The same principles apply to intermediate and custom garments. Proper wear of intermediate or custom compression garments is essential for effective scar management and patient comfort. The goal is to wear garments 23 hours per day, removing them only for scar massage, bathing, or wound care. Garments should be snug but not restrictive, and wrinkles should be smoothed out to avoid pressure points. For patients with hand and upper extremity burns, both a glove and sleeve should be worn together to prevent distal edema. If 23 hours isn't tolerated at first, gradually increase wear time by following a structured schedule.
When caring for garments, know that both intermediate and custom compression garments should be hand washed with soap and water daily and hung to dry. Do not place garments in the dryer or utilize bleach or fabric softener, as it can compromise the integrity of the garment. Providing a minimum of 2 sets of garments will allow for patients to have a set to wash and dry and a set to wear. Replacing garments every 3 months will allow for adequate compression to be achieved.
Regular compression checks are essential to ensure garments are effective and safe, providing optimal pressure and protecting the skin and promoting scar management. Begin by removing the garment carefully and performing a thorough skin assessment. Make sure the compression is adequate but not restricting blood flow, and watch for increased hypervascularity or early signs of skin breakdown. Ask the patient about any new numbness or tingling. Check that the garment fits snugly with even pressure, does not impede joint mobility, and is in good condition without tears or loss of elasticity. Adjust or replace garments as needed to maintain optimal scar management and patient comfort.
There are a few contraindications to any type of burn compression, as it can worsen outcomes and cause increased harm or risk to a patient. One contraindication to compression is any type of silver dressing. Any type of silver dressing under compression can increase the overall risk associated with this type of dressing, including skin irritation and toxicity. Infection is another contraindication for compression. Compression can worsen infection, causing increased pain, time to healing, and prolonged complications. Patients who have impaired sensation are not ideal candidates for compression, as there is a high risk of skin breakdown and pressure injuries associated, as they are unable to feel improper wear or discomfort with the garments. Patients with impaired ability to communicate are unable to verbalize discomfort or decreased sensation or inappropriate garment wear, causing harm to the patient. Young pediatric patients who are not yet verbal and nonverbal patients are examples of this specific population. Another contraindication to consider when placing a patient in compression is skin fragility, or patients who are at high risk of skin tears and shearing. Due to the compressive nature of the garments, patients are at an increased risk of shearing or skin breakdown if they have baseline skin fragility. We do not want compression to cause more harm than benefits.
Thank you for your attention. If you have any questions or need further information about burn compression garments, please feel free to reach out to either myself, Caitlin Clark,
Or Amelia Heckman.
at the email addresses listed above. We're happy to help and provide any additional guidance you may need.